Good morning. I am Dr. Mohammad Ali, Senior Gastroenterologist and Endoscopist, Interventional Endoscopist, taking care of all gastro, hepatobiliary and pancreatic disorders at Bilroth Hospitals. Gastrointestinal diseases, mainly coming to esophagus, you have people with heartburn, and this is mainly because of reflux of acid and bile into the esophagus causing heartburn, and we call it as GERD. This is also a problem of obesity as well as the lax esophageal sphincter. The other important esophageal problem is when people develop chronic liver disease. As I told you, chronic liver disease develop complications, namely they develop dilated veins which are called varices, and this varices may lead to bleeding. The other important thing is when they develop cancer, esophageal cancer, they will find difficulty in swallowing, they will not be able to take their food, and then we do an endoscope and we find out that the patient is having a cancer there. So these are the main esophageal problem. Coming to stomach, stomach is a big organ which helps in grinding the food as well as making the food small in particles so that it is suitable for absorption in the small intestine. Stomach, usually the problem in stomach is either you can get an ulcer, gastric ulcer. Now gastric ulcer, majority of the time small ulcers may happen when the patients develop some irritation drugs, like they take these painkillers or after consumption of acid for suicidal attempts, then you can find that the stomach gets affected, and then it can present with either hematemesis, which is known as GI bleed, upper GI bleed. Very rarely, of course not very rarely, cancers can also happen in the stomach. It can happen in the upper part as well as the lower part of the stomach, namely what we call as the gastrointestinal area. Duodenum is area wherein majority of the patients present with duodenal ulcer, what we call as ulcer. Normally patients will come to you, vaitvali varudhu sir, enakku ulcer irukku sir, ulcer disease. Now this happens in the first part of the small intestine, which is known as duodenum, and majority of this duodenal ulcers is related to an infection known as H. pylori, and it can be easily prevented. When they come with initial symptoms itself, do an endoscopy, take a biopsy for H. pylori, and we will know infection is there, give the treatment and the ulcer heals. The other type of ulcer is which we see in patients with smokers. This is also duodenal ulcers, not related to H. pylori, and we can get, so if you can prevent smoking, then you can prevent this ulcer. So avoid smoking, this ulcer heals. The other part of it is in the gastrointestinal tract is the colon. The colon can be affected by two problems. One is either constipation or diarrhea. Constipation can be treated with, say, enough fiber in our diet, or you have to substitute with some laxative drugs. Diarrhea, if it happens, it can be acute due to some acute gastrointestinal infections, due to some food poisoning, or you have a condition known as ulcerative colitis. Initially, this condition was not very much seen in our country, but of late, because of our food habits, environmental changes, ulcerative colitis, namely ulcers throughout the colon, are being diagnosed quite often, and almost 20% of the diarrheal problems are because of ulcerative colitis. Once again friends, ulcerative colitis is treatable, but regular checkups is necessary.